California is currently facing its most severe summer COVID wave since 2022, worsened by a highly infectious subvariant. The CDC reports California has reported very high levels of coronavirus in its wastewater for 4 straight weeks. Fox 11's Christy Fajardo, she's live with what this means. Christy.
Marla, we're seeing evidence more than just wastewater. In fact, it's all around us. No doubt by now you've noticed that some people are choosing to mask up in public places. And if you haven't had COVID this summer, you likely know someone who has. It's part of this summer surge that is impacting states across the nation.
And I don't think it ever will be a nothing. COVID's a serious infection.
Dr. Nathan Newman has seen the COVID wave at the Exeter Urgent Care Centers where he's medical director, like this one in Santa Monica. We also saw evidence of it on drugstore shelves, now emptied of COVID tests. And although hospitalizations are ticking up in our state, Dr. Newman says they are nowhere near the pandemic highs.
So people are less likely to die, less likely to get hospitalized because they've got that immunity from vaccination, and they've got immunity from natural infections, and the combination of the two.
Still, he warns COVID should not be taken lightly. The CDC now says more than half of U.S. states have significant COVID activity, and experts say a combination of factors are driving the summer surge.
First of all, our historic temperatures have been forcing people inside in close proximity, which leads to disease spread. In addition, the family of variants that is currently circulating, known as flirt variants, tend to evade vaccine-induced immunity better.
That's why Dr. Newman recommends testing for COVID if you have symptoms and acting quickly to get on a regimen like Paxlovid if you're at risk for complications.
If you've got COVID and you've got risk factors or you've got age, you want to get on an antiviral as soon as possible, because after that first week, you never know if it's going to turn into that inflammatory phase in the second week, which can lead to hospitalization and death. And at that point, antivirals won't help you at all.
And he says, even if you are the picture of health or recently had COVID, get vaccinated.
If you've had COVID recently, who knows when the next variant is coming out? There's always a new variant of COVID coming out. It feels like every month there's some different numbers and letter combinations, and those can hit you again, even if it's only been a few weeks.
That's why Dr. Newman says you should get vaccinated next month when the latest COVID vaccine is expected to be rolled out. Live in Westall, I'm Christy Fajardo. Let's send it back to you.